Namaste. My name is Dr. Shobna Bhatia and I am working at the HN Reliance Hospital in Mumbai. It is my pleasure today to interview Professor Takanori Kanai from Tokyo during the APDW Calcutta. Professor Kanai.
Thank you very much for a nice opportunity to introduce my experience in the field of the IBD. So I graduated at Keio University in Tokyo, Japan. And when I was a medical student, I was very interested in the immunology.
Okay.
Because Dr. Tonegawa got the Nobel Prize in the field of the immunology. Therefore, I was very interested in the immunology. Therefore, I was wondering whether I should choose any fields such as rheumatology or the IBD. But I chose IBD because at that time, IBD is a very, very important and hot topics. Therefore, I chose the IBD field in the gastroenterology.
So in IBD, when you started off, what were the areas of your interest?
I'm interested in the both ulcerative colitis and Crohn's disease, but especially I focus on the macrophages, dendritic cells, and acquired immunity, especially the memory T cell, such as TS17 cells or Th1 cells. How these cells are involved in the pathogenesis of ulcerative colitis or Crohn's disease.
So do you think the biologicals are able to affect these functions in IBD?
Yeah, I think so.
Okay, can you tell us a little about your work in that?
I studied role of the IL-17 cells in the pathogenesis of Crohn's diseases. Surprisingly, we found that some specific cytokines such as IL-18 and IL-12 stimulated mucosal T cells in the Crohn's diseases. At that time, we reported our findings in the gastroenterology paper in 1995 about the importance of the TS17 cells in the pathogenesis of Crohn's disease.
So 20 years later, you find that immunology is still as important in IBD?
Yeah.
Or has it changed its importance?
Still, immunology is very important, and maybe the immunology is important in terms of the treatment. For example, anti-TNF, anti-integrin, anti-12. These kind of the biologics are very, very effective for the patient with IBD. Therefore, immunology is very important. But I wanted to know the much more upstream of the IBD pathogenesis. Therefore, I moved from the immunology to a little bit of microbiology.
Yes, so I was coming to that. What do you think is the role of immunology in the extraintestinal manifestations of IBD?
5 years ago, Dr. Honda some very famous immunologist found that some specific microbiota instruct some specific T cell compartment. For example, cross-region coccoides or leptin can induce regulatory T cell in the mucosal site, while other specific pathobiont can induce TS17 cells. Therefore, the specific microbiota instruct our mucosal immunology. Therefore, we have to understand the role of microbiota for the pathogenesis initiation of the IBD. Therefore, we move from the immunology to microbiota.
Okay, so can I just digress a little in the microbiota? There is this concept of the hygiene hypothesis that when people had their parasites or infections in childhood, the prevalence of IBD was much lower. And as you went to a cleaner society, the prevalence of IBD has raised. Can you tell us a little about that?
Yeah, hygiene hypothesis. I don't like hygiene hypothesis because hygiene environment is very important to our society. Because hygiene environment reduce the incidence of the very severe infection such as pest or cholera or so on. But
Yes.
hygiene is very important. But besides a hygiene environment, we changed some habit to the Western lifestyle, such as a food or
Yes.
the antibiotics used too much, or some exercise or stress, so on. Therefore, the hygiene environment is very important. But we change it. We have changed our lifestyle.
So therefore, it is not only the hygiene hypothesis, but it is the changes in environment
Yeah, right.
that have increased the incidence of IBD
Yeah.
everywhere in the world.
Yeah.
Do you think these changes in microbiota are also important in the extraintestinal manifestations?
Yeah, sure. I'm gastroenterologist, and my majority is lower gastric tract. Therefore, at the beginning, I believe that the microbiota is for me.
Yes.
But many people now are very interested in the microbiota, such as diabetes, and neurological disease, and obesity, and skin disease, so on. Therefore, microbiota should be involved in the pathogenesis of extraintestinal disorders.
Of IBD.
Of course, IBD.
Yeah, extraintestinal. So I recently read your paper on microbiota in PSC.
Yeah, right.
So, and that is a very important paper.
Yeah,
Can you
yeah.
just tell us what you thought and how you
Yeah.
started that work?
So when I was a medical student, professor told me that the PSC is autoimmune disease or the immune-mediated disease. But I was wondering whether it is correct or not, because the corticosteroid or the anti-TNF, these kind of the strong medication are not effective for the treatment of the PSC. Therefore, I doubt such kind of the textbook literature, and I hypothesize that the PSC is not immune disease, but rather the infectious disease like Helicobacter pylori infections. Therefore, I started the PSC UC project maybe 2 years ago. So, at the beginning, we isolated the feces from the patient with PSC complicated with UC, and we adopt a very unique system, notobiotic system, by using the germ-free mice. And at the beginning, we inoculated the feces derived from the PSC UC patients into the germ-free mice. So surprisingly, such PSC UC mice developed increase of the liver T17 cells, but not in the germ-free mice inoculated with the feces derived from the UC alone or from the healthy control, suggesting that some specific pathobion it should be involved in the pathogenesis of PSC extraintestinal disorder by some specific microbiota. So at that time, the bacterial translocation is very famous, very important mechanism for the extraintestinal disorder. Therefore, we doubt some specific pathobion translocated into the liver by our system. So we carefully isolated the liver, spleen, and the mesenteric lymph node in a sterile manner from the PSC-UC mice and the culture. And surprisingly, we found that some specific bacteria only in mesenteric lymph node, but not in the liver, but not in spleen.
So that was a fantastic concept. Imagine Klebsiella pneumonia
Yeah.
being involved in the pathogenesis of PSC and IBD. And finally, do you think what is the future of the microbiota where we can think of preventing IBD?
Yeah, that is very important, my future's project. So recent days, many IBD experts treat the patient with IBD, but in the future, we have to cure the IBD. Therefore, to do so, we have to challenge such as bacterial therapy by using the specific, very good bacteria. Therefore, I think we have to move from some very expensive biologics to the some bacterial therapy, such as a kind of the FMT or the probiotics and so on. But to prevent the IBD, we have to change the lifestyle.
Yes.
That is very important to prevent the incidence of the IBD. So we have to change the lifestyle to take much more the dietary fibers and good sleep and no stress and exercise. That is very important.
Thank you very much, Professor Kanai. Namaste.
Namaste. My pleasure.